to those who are interested. So it's very exciting. We'll have the support that we were severely lacking this past year. And then what it also means, and why I'm here on this call with the Pima County Health Department, is that we're going to continue our partnership together. As we move towards program sustainability, we've realized that there are many aspects of the program that make it difficult and kind of laborious for you all to participate. And so we are fine-tuning, streamlining, and working through these processes to ensure that you can have a one-stop shop for completing your training requirements, for accessing the required data reporting, and for just submitting questions and finding program resources. So we intend to put it in one website, everything together, where you can just simply go there and make the process very easy. What that will likely include is that we no longer ask for baseline data and things like that take you all a long time to do. We just want you simply able to have access to rescue medications while school is in session. So there is likely to be some additional funding for medication refills. There's more to come on that for this year, so stay tuned, and we'll be happy to give you updates for the schools who are in need of extra medication. And what I'm going to do is just go ahead, if I'm able to, put in the chat or email me. But I also have another email, and it's stockinhaler@arizona.edu. And if you want to be on the listserv and receive communications and updates regarding kind of the future directions of this program, I'll add you to the listserv, and I'll be happy to disseminate that information to you. Are there any questions?
Thank you so much.
Perfect.
So I'd like to hand it off to Kate to talk about the Narcan Coalition.
Hi, thanks. Let me share my. Not showing my PowerPoint when I click share.
If you'd like, we can just attach. Okay, perfect.
I think there it goes. All right, so oh, sorry, hold on a second. There we go. So my name's Kate, and I'm from the Community Prevention Coalition with PEP. And we've been running monthly Narcan in Schools committee meetings for maybe 6 or 8 months so far. We started last fall and went through the summer and are still meeting. We started last spring and now we're still meeting this fall. The meetings are on the first Thursdays of every month at 2 p.m. on Zoom. And I've included the meeting ID and passcode here, but if you want to put your email in the chat, I can also add you to our email list and the meeting invite. So the group goals is to encourage school districts to not only, we know that a lot of schools have Narcan on campus with their nurse's office. which in an emergency, when you have very few minutes to get Narcan to a student to prevent brain damage, we're not sure how long it would take for someone to run, get the nurse to come to the student. The larger campuses, that could take a while. And so what TUSD has done, and what we're hoping other school districts will also do, is they have changed their Narcan policy so that all teachers, if they want to, and if they're trained, can have Narcan in their classroom. This makes it so that the time between an emergency and receiving Narcan is like seconds instead of minutes. So we're encouraging school districts to allow teachers to have Narcan in the classroom. And then the other thing that we're hoping is for schools to become distribution points so that teachers and families can get Narcan from the schools. The other goal of this group is to educate teachers and students about the dangers of fentanyl and about the life-saving medication Narcan. We think it's really important to get in front of students and for teachers as well to all be aware of the increased risk of fentanyl poisonings. We are seeing increases in the number of youth deaths over the last few years. It's just skyrocketed from what it used to be, and all of those deaths are attributed to fentanyl. A lot of times young people don't know that what looks like a prescription medication is actually a deadly dose of fentanyl. And so educating those youth to know that they shouldn't take pills that aren't from a prescriber, from the pharmacy with their name on it could be very, very dangerous. The classrooms that we've presented to, the students are very engaged and very curious and really want to know more about Narcan and about fentanyl because, of course, they don't want to, kids like to experiment and they do drugs for lots of different reasons. We're not shaming anybody for reasons that they may or may not do drugs. However, we do want them to know how dangerous it is to take pills that are counterfeit. And so the educational opportunities that this group can provide is fentanyl and Narcan presentations for teachers and staff, fentanyl and Narcan presentations for students, Facebook Lives events with the CPC and health department officials. And then the CPC also does professional developments on trauma-informed approaches, ACEs, addiction, and resilience, and more. We really have a lot of opportunities to provide professional development to teaching staff for a lot of different areas. So we hope that you will join us to start planning events for your school, and that is my presentation. Does anyone have any questions?
Thank you so much, Kate.
Yeah, of course.
So I think if there is one question in the chat, how to arrange for a presentation.
So put your email in the chat. I can invite you to the meetings. It's in the meetings is where we do all of the planning with the schools and school districts to start having everyone get on the same page and start engaging students and teachers. So if you put your email in the chat, then I can invite you to the meetings and we can get started.
Okay, great. If there aren't any more questions, or if there are questions that come up, we can.
Oh, I see another question. ACEs stands for Adverse Childhood Experiences, and they account for lots of different negative health outcomes over the span of a lifetime. And it's really important for teachers to be trauma informed and to understand what ACEs are so that they can understand that they're like most adults, if you're watching students struggle or experience toxic stress, then you're also watching them experience their ACEs.
Okay, Well, if there are any other questions that come up, feel free to reach out to either Kate or you can contact me at school support and we will connect you to answer any other questions. So thank you again, Kate.
Yeah, thank you so much. And I'll put my email in the chat in just a second so people can contact me directly.
Next, I'd like to invite Susan on to give from our EPI team to give our final monkeypox update.
Thank you. Thank you so much. Let me get my screen here. Hmm. Can you see my screen?
Yes, your
Oh, good.
presentation
You
is
see
up.
the
Mhm.
monkeypox update screen. Great. Okay. Hi, I'm Susan Scott. I'm with the Pima County Health Department, and I am a communicable disease investigator. And I'm filling in for Mariana Singletary. She's in a conference up in Flagstaff for the rest of this week. So I'll be doing the presentation here. So here is a slide that Mariana had presented last on the 20th of October, and it shows the total number of confirmed cases in the U.S. and then also just some other information like where places have not historically reported monkeypox and where places have before. So you'll see when we go to the next slide, this is as the 15th of November. It's been a very small increase. So total cases from, let's see here, 73,782 to 79,655. This is a slide that Mariana had shown back in October, showing where the majority of the cases have been, and showing that the orange dots are locations that have not historically reported monkeypox. The blue dots are for places that have shown monkeypox in the past. And you'll see when we get to our next slide here, this was just done on the 15th of November. It really hasn't changed a lot. And then another slide here. This shows the number of cases per state. And the next slide here, this is as of the 16th of November. It's pretty much the same. And here we are with our month-to-month comparison. So the first number you see there is the number of monkeypox cases reported in October for the week of the 16th through the 22nd, and then on the week of the 13th through the 19th of November, it shows 132. And then this number 60 here is the total number of cases that have been in the state of Arizona, and you'll see that it has not changed, 60 and 60. This is cases by the EPI week with the total number of confirmed and probable. And right now, for this week, we just have one suspected case, meaning that they have been tested, but the test results have not come back yet. And then this shows here the confirmed and probable cases that have been identified. And you can see here, not since week 42 was there a case that has been identified. Here we are in week 46, and the news for this week is that there are no school-age monkeypox cases in Pima County. If you think there's someone that has monkeypox, we ask that you please request a healthcare provider evaluation, and please continue reporting suspected cases. Suspected cases must be tested to be confirmed, meaning that just by sight, monkeypox is not confirmed. It's not a real infection just by looking at it. It has to be, the lesions have to be swabbed, and then that is tested for monkeypox. And if there are any positive tests, they will be reported to us here at the Pima County Health Department, specifically within the epidemiology department. If there are any suspected cases, they should go home and seek medical evaluation and wait at home until receiving the test results. And test results take anywhere from 48 hours up to 5 days or so. And then, of course, if it's negative, then the healthcare provider or the medical provider should look at alternative diagnosis for any sort of rash that they have. And if they are tested positive, they will stay in isolation until all lesions have scabbed over and they lose their crust. They are able to go back to school when new pink skin shows on the old lesion site. The next step for the Pima County Health Department is we are continuing disease surveillance at the county level. We are continuing offering testing of monkeypox at Pima County Health Department clinics, and we are also continuing offering vaccines at the clinics. Pima County has expanded the eligibility for monkeypox vaccine in October. Vaccines so far are only available through public health, through Pima County Health Department. Outbreak and community. Anyone have any questions? Oh, one more slide here. The information on how to contact Mariana is available on this slide here. You can call the main number for the epidemiological phone number, and that number is listed there, or you can contact Mariana directly. All right, that's it. Any questions?
Thank you so much, Susan.
My pleasure.
It looks like there is a question about RSV, but we might get to that after the next section of this presentation. I'd like to invite Anissa, also from our EPI team, to discuss our updated guidelines on indoor events, as well as our close contact letter.
Hello, everyone. Let's see. Okay. I can share my screen. Celine, do you have the guidance or would you like me to share my screen?
Can you share your screen?
Sure. Yeah.
Thank you.
Okay. Let's see. So here is, can everyone see that? Oh, no. That's my email. Let's see. Okay. So basically, what we've done is reviewed our guidance from last spring, and we've updated it for indoor events. We have had some concerns about concerts and, of course, sports that take place inside, plays. It's winter time, so we're going to see people congregating inside more. And so we just want to make sure that all the schools are practicing really good efforts to prevent as much transmission as possible. Of course, outdoors is going to be better for ventilation, but as it gets cold and things are happening in the evening time, we just want you to be aware of these best practices. So again, these are best practices by the health department, CDC, and EDHS. Celine mentioned earlier what our community level was in terms of COVID, but in regards to other respiratory viruses that are circulating, someone mentioned RSV, influenza is also circulating. You know, we see pertussis at this time of year, and we have other viruses, rhinovirus, enterovirus, adenovirus. they're all kind of what we would consider the common cold. Now, as you know, social distancing and masking are probably and good hand hygiene are our best ways to prevent transmission. Of course, staying at home if you're sick. So if you're having these indoor events, we recommend that you review these with your administration of the school, make sure that they agree to them. They talk about being in place 6 feet or more for people. Say for performers, we want performers to try to be distanced. They go into great detail about having staff and performers up to date with vaccines, if possible. If someone is sick, make sure that they're not there, you know, that you have a backup or an understudy for your plays or winter formals or whatnot. And it talks about really good disinfection of equipment, of high hand surfaces, high touch surface areas, microphones, instruments, all of those things that would be in place where you're going to have performers, actors, or whatever the setup is going to be. So Pima County has updated this guidance and our school team will send this out to you all. It's based on best practices from the CDC. So if you have any questions, you're welcome to give us a call on these things, but this will be going out. So I'm just kind of scrolling through it. But again, and it could change. It could become a little bit more stringent as if we start to see an increase of cases. So that's something the schools will have to decide. Do you have to close down or postpone some type of performance? Well, really, that's going to depend on what's going on with your school, and that's going to be up to your administrators, right? So if there's a big outbreak and your principal is saying, you know, no, we're not going to do this right now, let's move this over, this event over, then that's going to be at the discretion of the school. But we do ask that you let us know just so we can help make sure that you're going through all those mitigation efforts and we can be a resource to you. So that's all I have, unless you have any specific questions.
Kathy, if you'd like to ask your specific RSV question, you can go ahead now and we'll try to answer it.
Aha, okay, I have sound. Sorry that took but a moment. Yeah, I have a couple questions about RSV. We're beginning to see kids diagnosed with RSV in some of our elementary schools. And I guess I have a couple questions. Number one, we haven't seen any clustering in any particular class or activity, but at what point, even though it's not a reportable disease, do you all want to hear if we're having issues? And number two, do you know how long they're communicable after they're diagnosed? I've had several questions from nurses and families on how long the child should stay out.
May I answer those questions?
Thank you,
Celine?
Lisa.
Okay. So we, you know, prior to COVID, the schools were pretty good about, as you know, Kathy, we work very closely together about reporting what we call ILI, right? So that just kind of encompassed everything that may have been flu or look like flu. And what we've asked is that that's done at, and the state's pretty loose on the terms of what's an anomaly. We say 10% of either the classroom or the school. We'd like to know about it just because it really helps us find out what's going on and how we can help other schools or target other areas, right? If we're seeing clusters in schools and we don't know about it, well, this could be affecting, you know, hospitalizations or increased people going to urgent care. So it's really a detector for us, so like a sentinel site, if you will, and it also will provide us more open communication with the school. So I would say if you're seeing numbers that are above normal, right, it's pretty common to have a kid or two out right now during this time for those symptoms, for RSV, influenza, any of these kind of cold-like symptoms. Of course, if anyone has a a fever, then, you know, there is very specific guidance that they need to be out, and that's per Arizona Administrative Code. So that's different. And we say natural when the flu goes away, it should be from naturally going away and not from like a fever reducing medication. So, if a child's unwell in your classroom, then they really shouldn't be there. But if you're starting to see, okay, now it's popping up a week before Christmas and, half the kids are out of the classroom, then yes, it would be great for us to know. And we have our good old line lists. They're not required or mandated by any means. They're really just a tool to help keep track and look at the epi curve and see where we are in the outbreak. So this is not like a COVID requirement by any means. It really is just a tool to keep track, to help the nurses, help the health staff, and help the epi team help you. So if you're unsure, you can always give us a call. I can leave out our number here. It's our general number. You can call the school's number, all of those things, and reach out to us and we can walk you through it. So if you have any questions about that. And as far as RSV, it may depend on the child itself in terms of their immune system. Sometimes we're seeing co-infection, so that's something to be really mindful of. Sometimes a child can be sick for a week or even 2. They can have that lingering cough and then be open to getting another co-infection. So just being really transparent with parents about keeping them out if they're not well. That's really important. Encouraging mask use. It's not mandated, but we encourage it. So yeah, those are the things. Cleaning. If you know that a kid's gone home and they were diagnosed with RSV, it's droplet spread, right? So all those coughing and the mucus and their hands touching everything, please increase your disinfection of the classroom the same we would with COVID. So.
Okay, and then my only other question would be, I know RSV is always around and usually it just looks like a cold. We don't normally get RSV diagnoses in school that we hear about. Are we seeing older kids being hospitalized?
Now, as far as
an infant disease.
I mean, anecdotally, what we've heard, because it's not it's a lab reportable, and so it's the reporting requirements a little bit different in the hospital system. I can't give any information in terms of the age groups that are hospitalized. Typically, we do see it's more severe in younger children.
Right.
Now, again, we have seen there's potential for co-infection, right? So if someone has COVID and they also have RSV or they have flu and RSV, well, yes, and then they're more likely, or they have asthma and RSV, they're more likely to have more longer symptoms and possibly be hospitalized. But we have heard anecdotally there's been more hospitalizations in general in the pediatric units. But as far as the age group in Pima County, I'm not sure on that data right now.
Okay. Yeah, I wasn't sure it existed or not. Okay, so basically, as long as they are feeling well and fever-free for 24 hours without cheating by giving